we can go ahead and start.
Okay.
I'll do that. So, hi everyone. Those of you that have joined us, I'm Tara Littleton, your Workplace Experience Manager for BICA. And today we have Tara Davis-Rama, Diversity and Inclusion Program Manager for Alzheimer's Association, sharing with us 10 warning signs of Alzheimer's. So I'm going to pass it along to Tara, and she's going to give you, share with us the warning signs and also tell us a little bit about herself and how she got into this program and all of that good stuff. And then we'll have some Q&As after, and we'll have closing words, and everybody will be done and on their way. So Tara, from one Tara to another.
Hello, thank you so much, Tara. Hello, everyone. Thank you for allowing me to join you today and share the 10 warning signs of Alzheimer's disease. Once again, my name is Tara Davis-Rama. I am the Diversity and Inclusion Program Manager for the association. I've been with the Alzheimer's Association this past June, made 2 years. And the communities that I work with regarding caregivers in the community, I work with churches, universities, businesses such as yourself, healthcare facilities, populations that I specialize, if you will, in providing this information to, and I'll share with you more why those particular populations, the African American community, the Latino Hispanic community, the LGBTQ community, the Asian community, American Muslim community. We're starting to work more with millennials and also vets. We're seeing more and more individuals who are coming back from the service presenting with symptoms of Alzheimer's disease. But my real reason for doing this work is in 1998, my mother was diagnosed with Alzheimer's disease at the early age of 55 years old, and what is referred to as early onset Alzheimer's. And in 1998, my mother, we didn't know a lot about this disease. And, you know, in all fairness to the doctor, they didn't have a lot of information about it either. But they took a lot of tests. They ruled out everything. They told us that for sure she has Alzheimer's disease, but we'll know for sure during her autopsy. So not only were we told my mother had this disease that was going to take her away from us while she was still with us, but it was also fatal. And in March of this year, at the age of 80, my father was diagnosed with Alzheimer's disease. So I do this work for those individuals, but I really do it as a labor of love for my parents. So today I'm going to share with you, and I'll share my screen in a moment, the 10 warning signs of this disease. So if you know someone who has these signs, or maybe you even see these signs, and every time I do this presentation, people always say, oh my God, I see these signs, I exhibit them sometimes. Don't be alarmed, you know, because normally there's a series of things that you can do, and I'll talk about that. You don't have to have all 10 of these signs. You don't have to have 9 of the 10 or 7. It could just be one. And if you notice a loved one or even yourself, I always encourage people to make sure that you see a healthcare physician. So now, without further ado, I'm going to share my screen and begin the PowerPoint presentation. If you have questions, Tara, I don't know how you want to do it, but I'm okay with people stopping me during the presentation to ask questions, or we can wait till the end.
Yes, if people want to put in their questions into the chat or the Q&A, I will be more than happy to, you know, submit those questions to you. Or if they want to do a Q&A verbally, that's fine as well.
Okay, perfect. So I'm going to share my screen. And Tara, please let me know if you can see it.
Sure. Yes, ma'am.
Okay. So know the 10 signs of early detection. You know, just something I want to share, that one of the important things with this disease is early detection. You know, knowing a lot sooner than later. So forgive me, that just went quicker than I wanted it to. Of course, technology is always at its best. So this is an actual person, Jay Smith, whose wife was diagnosed. And, you know, he said if we could have had a correct diagnosis even 2 years earlier, it would have given us more time to plan, to do those things that result in a good quality of life, and to accomplish the things we always wanted to do that we put off for this reason or that. I love to share this because early detection is key to knowing if you experience and know someone any of these signs. The sooner you find out, the better. Unfortunately, it does not change the projection of this disease. However, it does help you to be able to plan what life will look like, because life will certainly be different. I also want to apologize. We have videos embedded in the PowerPoint, but when we do the Zoom and other platforms, they don't play. But normally it's just something that follows up on what I said. So I apologize for that. These are just some of the people who actually have the disease, and they briefly share their story, but they're in video, so I do apologize. You won't be able to hear it. So Alzheimer's disease versus typical aging. A lot of times we think that Alzheimer's disease is a part of aging. It is not, in fact, a part of aging. We all forget things. We all may not remember something, but it doesn't mean that it's a part of aging. So it's a myth. Having a little touch of dementia is a typical part of aging. No, that is not the case. Some of our physical capabilities may diminish, including our memory, but having a harder time remembering different things is certainly different than aging and having dementia or Alzheimer's. What is Alzheimer's? A lot of people wonder, what's the difference between Alzheimer's and dementia? Well, Alzheimer's is a form of dementia. Dementia is the umbrella, and Alzheimer's is one of the dementias. Alzheimer's is the only form of dementia that is fatal. About 70 to 80% of all dementias result in Alzheimer's disease, or they all Alzheimer's disease. So for the other one, dementias, we have Lewy body dementia. And that's when the individual presents with symptoms like Parkinson's disease. We have frontal temporal lobar dementia. Normally an individual has suffered a brain injury, a traumatic brain injury. It could have been, a surgery. Some people experience it after like anesthesia. Those are rare cases, but they do happen. There's vascular dementia, when individuals who suffer or may have issues with heart attacks, strokes, that can result in vascular dementia. There's a mixed dementia. You can have one or more of these dementias. In fact, my mother had mixed dementia and Alzheimer's disease. And then, of course, there's Alzheimer's as the other form of dementia. So what is Alzheimer's? It's a progressive disease of the brain. It destroys the brain cells. It causes problem with memory, thinking, and behavior. So in the beginning, the individual certainly has a hard time remembering things, doing things, but as it gradually progresses, the individual, the brain cells are being destroyed. So when you hear people say, oh, we have a cure for this disease, if you drink coconut oil, if you do all these things, that people come up with, none of that is true. There is no cure for this disease. There's no slowing down the progression of Alzheimer's disease. There's no reversing the symptoms of it. The disease takes its course. There's normally 3 stages to the disease: the beginning of it, the middle part, and then the end, which is the severe, and that's normally the part where it becomes fatal. So unfortunately, there is no cure for this disease. Dementia, as I stated earlier, it's a general term to describe decline in cognitive functioning. And there are other issues or sicknesses or illnesses that we can have that can cause us to have a decline in cognitive functioning. And I'll talk about that a little later. As I stated, Alzheimer's disease is the most common form of dementia. 70 to 80% dementia is Alzheimer's. And once again, there's no treatment for this disease. There are medications that treat the symptoms, and I will talk about that towards the end of this presentation, but it does not treat the disease. It does not cure it. It does not reverse it, fortunately. So once again, myth, if I have memory loss, that means I have Alzheimer's disease or dementia. Excuse me, that is not true. Many people will have problem remembering things, and it could be for a number of different reasons. It could be just you're exhausted and you can't remember, or you can't remember your telephone number from when you were 12 years old. That's okay. I mean, unless, if you're my age, and I won't share what that is, but there's no need for me to remember my number from when I was 12 because I don't use that number anymore. Our brain has a way of pushing those things into reserve that we don't use constantly. So having some memory loss does not mean that you actually have dementia. But if you find yourself or you have a loved one that's frequently having bouts of memory loss, then you certainly want to take them to go see a physician. So we're going to talk about some of the risk factors for Alzheimer's and how the risk affects individuals. Also how the risk affects the communities that I named in the beginning, the African American, Latino, Hispanic, LGBTQ, Asians, Muslims, millennials, also vets, but everybody really. I mean, there are some things that we can do to hopefully prevent us from getting dementia or Alzheimer's disease, but then there's just the gene that some people have, and if you have that gene, unfortunately, then your chances of getting it is extremely, extremely high. The highest risk factor for getting Alzheimer's disease is age. And as I shared, my mother got it at the age of 55, what we consider early onset Alzheimer's. You know, there are some people now being diagnosed in their 40s, unfortunately, but the primary risk factor for this disease is age. So the older we get, the more likelihood we're at risk of getting it. It does not mean we will get it, but we are at greater risk. This incidence is high in women because women typically live longer than men. Some other risk factors, diet, you know, eating all those things that are not good for us. There's a correlation between having a healthy body and a healthy mind. You cannot have an unhealthy body and a healthy mind, or unhealthy mind and a healthy body. So making sure that you eat those things, you eat those foods that are good for you. So talk to a nutritionist, talk to a doctor. Also getting exercise. You're talking about just bare minimum. You don't have to go out and buy a gym membership, but you can get out and walk 15 to 20 minutes, 3 days a week. Can certainly not only help your health, but also your brain, because it's getting that oxygen to the brain that's needed, and your body is healthy. So if we treat our body healthy, the brain will be healthy. The other thing is, you know, using our brain. That saying, if you don't use it, you lose it. Well, that's also true for the brain. So engaging in things that will challenge us. A lot of people say, oh, I do crossword puzzles, so I should be fine. Once you've mastered the crossword puzzles, you really need to move on to something else. You know, Sudoku is fine, that's challenging. Learning how to play an instrument, that's challenging to the brain. Learning a new language is good. Learning how to play chess, you know, all those things, taking a class, reading things that you normally wouldn't read, that would really help to expand the brain, if you will. And then the other thing, you know, in this day and age, one of the things we encourage people to do is not to become socially isolated, you know, but good thing is we have a platform now where people can still socialize, but do it virtually. So I'm not encouraging anyone to go out and socialize in person. I want us to follow the guidelines of this pandemic and social distance and wear our mask, but, you know, certainly make sure that you're staying connected to other people. And the last thing is when we get lack of sleep. Because I can't see anyone, but you just see my PowerPoint, and you can just raise your hands wherever you are. How many of you, on an average, every single night, Monday through Sunday, every single night, you get 7 to 8 hours sleep? Okay, good. I know Tara does. So that is so important. There's really, you know, a strong research and correlation to lack of sleep takes years off our life. Lack of sleep causes other issues, weight gain. Lack of sleep causes foggy thinking. Lack of sleep causes memory loss. So making sure that we get the appropriate amount of sleep. And I don't mean I went to bed at 9 o'clock, but I woke up at 1, and then no, like uninterrupted, that deep REM sleep is what we need for our brains to you know, kind of regroup, to repair itself, and to stay healthy. So if you don't get 7 to 8 hours of sleep every night, then make sure you start doing that. Turn the phone off, turn the TV off. You know, don't read a book before bed. Don't listen to music, because when we do those things, our brain is still active. And even though we've fallen asleep, our brains become, they're still very active. So making sure that you get your sleep, because lack of sleep can also present symptoms as having Alzheimer's disease. So if Alzheimer's disease runs in your family, genetic testing will tell you if you will get it also. So, you know, having a parent or sibling with this disease increases your likelihood of having it. You may not get it, but it certainly increases your likelihood for having a parent and a sibling. I was tested after my mom was diagnosed. I was not at risk. I did not have the gene. So when my father was diagnosed this past March, I didn't go back and get a test because I know that I don't have the gene. So, and there's testing that can take place, and I'll talk about that at the end. But so just because it runs in the family, it doesn't mean that you'll get it, but you could be at risk. There's only one family in Antigua, Colombia, the country, and their entire family has been diagnosed with Alzheimer's disease by a certain age. So the genetics of this looks like the gene is called the APOE-E4, and it's linked to greater risk of later onset Alzheimer's. And that's normally around 75 and older. This type of dementia is most common and associated with old age. It's a good idea to discuss benefits and risk of testing with your doctor or genetic counselor. When my mother was diagnosed, it was a series of tests. It was a lot of hit and miss. Today, they can simply do a scan of your brain, and that's what they did with me several years ago to see if I had it. And then, they, of course, they tested me for, did blood work for the gene. But the test's a lot easier and a lot more simplified. So having the gene, once again, it only increases your chance of developing it. It does not mean that you will actually get it, but it does increase your chances of getting the disease. So brain health comes from a healthy body, and I talked about that. I just want to reiterate because I think it's so important that we keep our body and our brain healthy. Start small, start with something you like, do it often, always talk with your doctor before starting anything new, but having a healthy body correlates to a healthy brain by learning new things, eating, and having an active social life. The risk for Alzheimer's disease or vascular dementia is increased when we have damaged heart or blood cells. People who suffered strokes or who suffered heart attacks puts them at greater risk of developing vascular dementia or Alzheimer's disease. Diabetes, a lot of people have diabetes and may go untreated, or they're diabetic and they know that, but they take the medication so they continue to live the lifestyle they did, and it's not effective. So it can lead to Alzheimer's disease. And also, as I stated earlier, there's a strong link between serious head injury and a risk for dementia, because the brain cells, it all depends on the injury. The brain cells have been damaged, there's been some trauma, so it can cause memory loss, which leads to change in behavior and not able to function just in everyday life. So let's talk about the 10 warning signs. And remember, the individual doesn't have to have all 10. They don't have to have them in the order that I'm going to present them. It could just be one, or it could be two. And if you notice this in someone, you want to make sure that you take them to see a medical doctor immediately. So the first one is the memory changes that disrupt our daily life. So the individual forgets something that they've recently learned. They'll ask the same information over and over again. Like when I met Tara and she told me her name was Tara. And if I said, oh, okay, Tara, can you tell me your name again? And she tells me her name, and 10 seconds later, I say, oh, can you tell me your name again? Well, the individual, they haven't forgotten the question because they're asking the same question. Just that quickly, they're forgetting the answer. Short-term memory is the first thing to go with Alzheimer's disease. So it's not the long-term memory, it's the short-term memory. Individuals will rely on memory aids or family members to do things that they used to do. And, you know, we noticed this with my mom. It was after the fact. You know, she would have us do things that she would normally do. And sometimes it's like, why is mom asking us to do this? Because my mother knew that there was something going on in her life with her, but we didn't know, not at the beginning. So we saw that daily disruption in her memory that disrupted her day-to-day living. So that's the first one, memory changes that disrupt your daily life. And she just talks about in this video, and once again, I do apologize, how she would rely on memory aids, but she would forget what the memory aids were. So she would spend all this time creating them, and then she would forget what the memory aids were. So also there'll be challenges in planning or solving problems. You know, not being able to follow a simple plan, something that they've followed before. Problems with numbers. You know, I always share that my mother was the accountant in our family. You know, you didn't count her money, she counted her money, no one else did. She counted everyone else's money, but you know, she kept us all on track. And then one day I remember when my mother had the signs that I had taken her shopping, and we had gotten back to her house, and I gave her her change, and it was a $5 bill, two $1 bills, a quarter, and two dimes. And I gave her the money, and I just happened to look over at her, and she seemed to be confused what was in front of her. And I said, "Mom, you okay? That's your change from the store." And she said, "Well, what is it?" And I, you know, it kind of took me back. And I said, and I told her it's a five, it's a two $1 bills, and, you know, showed her her receipt. And she said, "Oh, I don't have my glasses." You know, another sign that we totally missed out on, or maybe we didn't want to recognize that something was going on with my mother. Problems following a familiar recipe. You know, the individual may make their favorite apple pie, and then you ask them to make it, and they're asking you, "Well, what goes in it?" "I don't know how to make an apple pie." You know, difficulty keeping track of their bills. They may get their bills, and you know, a lot of older people, they don't pay their bills online, so they pay their bills either by going to the bank and paying them or mailing them off. And they'll just pile up because they forget that the bills came in, or they forget that they have to pay them. They have hard times and challenges with concentrating, because remember, the brain cells are beginning to deteriorate. They are deteriorating. If you look at a picture of the brain, it's like a healthy head of cauliflower. And you buy that head of cauliflower, you put it in your refrigerator for 2 or 3 weeks, and then you go pull it out, and it has like what looks like mold, and it's beginning to wither, if you will. Well, that's very similar to what the brain looks like when the cells are being destroyed and Alzheimer's disease is taking over. It will also take the individual longer to do things that they did before, maybe putting on their coat or putting on their shoe. Just simple tasks that they would normally do, or we would do with no effort. It would be challenging for the individual. So the third one is difficulty completing daily tasks, trouble driving to one's familiar places. I've talked to people, you know, they said, "Oh, you know, my loved one got lost coming home from their place of worship. My loved one got lost going to, you know, their job." Some people are diagnosed and they're still working. So they have a problem going to once familiar places. One person said, the person actually had the disease, said they were able to get to their street, but they could not remember which one was their house. Problems managing a budget at work, if the individual is still working, or even at home. And then difficulty remembering rules of the favorite game. My mother cheated in every game we played, so when she continued to cheat, we were like, "Oh, Mom's fine. There's no problem there." But, you know, a game that they used to play all the time, they no longer remember the rules to the game. And the fourth one, losing track of dates, seasons, passage of time, forgetting where one is or how one got there. You know, it could be a 90-degree day, and they don't realize it's summer. You know, they think it's winter. You know, now we have some fall days, or we do have 80-degree days, but for this individual, they can't distinguish, you know, this is the winter season, this is the summer season, this is the spring season. They're not able to do that. They'll go somewhere and forgot how they got there. Normally, this is when you start to see the person will begin to wander. You know, I remember a couple of times my mother wandered. It scared us so much that, you know, we had to begin to put things into place, because she would go somewhere, forget how she got there, or she would forget how to get back home. So the fourth one is confusion with time or place.
Tara, I just had a question real quick. someone has that knows someone that's having those symptoms, but
Mhm.
consistent with the symptoms, should they be concerned? Is
Yes, yes. And so normally I save it to once I get to the end of this, but if you know someone that's having one or at least the four that I mentioned, you want to take that individual to go see their doctor, schedule an appointment immediately, tell them what's going on, have someone go into the doctor's office with them. We made the mistake of not doing that in the beginning with my mom. And of course, everything was fine. And we're like, wait a minute, we're seeing this, but you're saying the doctor said you're fine. So when we went in with the doctor and we shared with them everything that we were noticing my mother was doing, that's when they started the test. So you want to go see a doctor, one, that's the first thing. Tell them everything that you've noticed regarding the individual. If there's a family history or not, you still want to let them know. They will begin to do a series of tests. The doctors normally don't make the diagnosis, so they'll do a series of tests, and if they feel like they need to refer the individual on to a psychiatrist, a gerontologist, a neurologist, they will. And that's when the diagnosis will be made. And sometimes, unfortunately, there may be a misdiagnosis, but if you know that you know that you know this person is exhibiting these signs, you can also follow up and get a second opinion. So seeing a medical doctor is the first thing. It could be something medically wrong with them. The individual could be suffering from dehydration. It will present all these signs that I've gone over and I will go over. It could be constipation, believe it or not. It could be a urinary tract infection. It could be a medication that they're on that's now they're having a side effect to. They could have a medical illness that has nothing to do with the brain that hasn't been treated, but once it's treated, then you'll normally see these things diminish. But certainly seeing a medical doctor is key, and seeing it soon if someone is experiencing these signs. The fifth one is diminishing the trouble understanding visual images and spatial relationships. They have difficulty reading, trouble judging distance. They normally, at this stage, they normally trip or they fall a lot because they have a lot of trouble with judging the distance. Just something simple as picking up their foot or taking a step, putting one foot in front of the other. We began to see my mother was starting to move into the second stage of this disease when we had taken her to my sister's house for Thanksgiving dinner. Been there so many times before, and it was such a struggle and a challenge to get her to walk up the stairs. She was so fearful because her brain wasn't allowing her to be able to judge the distance, or even to allow her to say, you just step up to go up the stairs. So after, a lot of deliberation, we just decided, let's just pick mom up and bring her up the stairs and into the house. They also have hard times determining color or contrast. Really, things appear to them a lot closer than they are or distance. And once again, that's just unfortunately a function of the brain, the cells being destroyed. So the next one is new problems with words and speaking or writing. You'll notice as they progress throughout the disease, they'll have problems joining a conversation because they can't remember the words they want to say. They can't follow along in the conversation. So they'll begin to withdraw. They'll constantly repeat the things that they've said or that you've said. And the individual is very well aware that this is going on. So it's very frustrating to them. They may become agitated. If you notice it, you can offer them words or kind of help them finish, in a respectful way, help them finish what it is that they're trying to say. But it becomes harder and harder for them to just engage in conversation or to keep up, or, not repeating what was said or asking the same thing. Calling things by the wrong name. They may make up names for something. They may call the TV the microwave. They may call the microwave something else, giving things names that you may say that makes no sense. So if certainly you don't want to say that. What are you talking about? That makes no sense. No, I'm not sure. What are you talking about? I don't know what you're referring to. You may want to help them out when they're having difficulty with the words or calling things by the wrong name, helping them to call it by the appropriate name. The seventh one is they misplace things, losing the ability to retrace their steps, putting things in unusual places, maybe coming in the house, they may have some groceries, get a call on their cell phone, answer the phone, put away the groceries, get off the phone, and wonder where are the keys? I want to put my keys on the hook. I realize I didn't put them there. So they can retrace their step. Normal brain can say, I came in the house, I got a call, put the fruit in, there's my keys, in with the oranges. But an individual who's experiencing Alzheimer's disease or dementia, they can't even go through that simple process of retracing their steps. We've all done this, sit in a room in our house and we get up and we go to another room, or even in our offices, and what did I come up here for? So we go back to where we were to help us remember what we wanted, and then we'll go back. Normally an individual who's experiencing this will get to the room and they may ask, whose room is this? So they're not even aware at that moment where they are. Now it may come to them, but they're not aware. So accusing others of stealing, we went through this with my mom. This was so heartbreaking. The first time she accused my sister and I of stealing from her, but we realized she just didn't remember where she put her purse. So in her mind, the natural thing was, I know I put it here, so someone had to take it. So we would help her hide her purse from us, who she thought was stealing from her. And this happens a lot across the board with men and women who have this disease. So when she wanted to get it, we knew exactly where to go. So because they can't remember where they put something, then they'll normally accuse someone of taking their stuff. The eighth sign is decreased or poor judgment. They have very poor judgment and decision making when it comes to spending money. One woman shared with me at a conference I spoke at that her mother would just go out every single week and buy all these coats, and she would come home with all the coats and they would take them right back, and she just, what can we do? I said a couple of things. You can decrease her limit. You can turn off her card. Maybe she shouldn't be going out of the house by herself, because would hate for someone to take advantage of her financially. There's so many different things that you can do. Tell the store, write on the back of her card, ask for ID, do not accept the card, because, the judgment with money is decreased. They may give large sums of money away. I'm so glad now that a lot of banks have implemented that if a senior comes in and they're asking for money, amounts of money that they haven't asked for before, or someone's with them that they're not used to seeing with the individual, that they will not allow that transaction to happen. They spend more impulsively, they just buy things, once again, wearing clothing that's inappropriate. So on a day where it's 25 degrees, they may go outside in shorts and flip-flops, because they just can't distinguish that the weather is changed. And they, may not even feel the cold. So, their judgment is decreasing and will continue to decrease throughout this disease very drastically, unfortunately. To where they forget to things like eat. A lot of people, my mother would say, oh, I'm hungry. And then we'd make her something to eat. And she's like, I'm not hungry. Or, vice versa, she would eat and she would say, I'm hungry. So, you do the back and forth like that. The ninth sign is they begin to withdraw from work or social activities. They no longer want to engage in their favorite hobbies, their social activities. If they're still working, once again, they may withdraw from work projects, family gatherings. They lose track of their favorite sports teams. They may even tell you, hey, let's watch the game. I don't watch football. I don't watch basketball. But this person is an avid football or basketball or baseball fan. They avoid social situations because of, several of the signs that I mentioned. They're having a hard time finding the right word. They keep repeating themselves. They keep repeating what other people are saying. They're losing their concentration. So they'll just completely avoid social situations altogether. And the last one is the changes in mood and personality. And these signs are the medicines are for these signs. Once again, there's no medicine that could cure this disease or treat it. The medicine is for the signs. And what are these signs? They become confused, right? They don't know where they are. They don't know who you are. They don't know who their loved ones are. They don't know how they got there. Suspicion. They're always very suspicious. There's a lot of fear, anxiety, and agitation. So that's what the medicine is used for, to treat those signs. So those are the 10 signs. And once again, if you see one or all of these signs or some, talk with the individual, let them know what you're seeing, what you've experienced, talk to other people, see if they're seeing it also who are close to them. Please visit a doctor ASAP, because visiting the doctor can mean a correct diagnosis if they have it, but also it could be something else and they can be treated for that.
All right, thank you so much. I do have a question
Okay.
from one of our people that have joined us. So they have a father, their dad is 88 years old and he has dementia. And the senior center where he would go twice a week with his wife, obviously is closed due to COVID. Activities or games would you recommend to keep him occupied during the day?
Wow, yeah. So it all depends on what the individual likes doing. So if they like to read, I would say, read with them, share new things. If they like to go for walks, if you can, if they're able to walk, take them for a walk. It may get tricky because, one day what they like to do may be different for the next. So you can kind of map out a schedule. Always ask the individual what it is that they would like to do. You can come up with ideas, but you wanna always encourage them to be a part of the decision making. And if they don't want to do anything, if they don't want to go out the house, then sometimes, you could try the back and forth. I don't encourage that a lot because it just becomes frustrating to you and the individual. But whatever they enjoy doing, and I know this may sound horrible, even if it's sitting and watching TV, allow them to do that. But also please feel free to offer them new things. We have a website. Our website is alz.org. And there's a plethora of information on there and different ideas that you can try. There's also other people who go and they post things about their loved ones, their family members, and different things that they've tried. So that's helpful. We do offer support groups. They're all virtual now. So they can join the support group and interact with others. We have memory cafes for individuals who are in early engagement. So that's more virtual interaction with someone. They may enjoy that. But, just see what they're willing to do and just go from there. But encourage them to do things that they really like.
And Tara, I have a question. I don't know if anybody else has a question, but for the diagnosis, is that typically a first visit to the doctor? Sometimes you have to get second, third, fourth opinion. Is something such as this disease, is that, kind of indicated with the doctor and recognized sooner, opposed to having to go to more doctors? In other words, how sometimes we have to get a second opinion or a third opinion, like I said. Is this a kind of a quick diagnosis, or does it take a while?
Unfortunately, it's not always a quick diagnosis because remember the first diagnosis, the first test is with the primary care. So they'll ask questions, family history. You go, you meet with your doctor for the 15-20 minutes, and then they'll probably schedule you to come back for a test, and they'll do a series of tests, and then from there you wait for the results of that, and then they may ask you to come in to talk to you about the results, and then so if the results are not satisfactory, then you're referred on. So then you would have to make an appointment with either a neurologist or gerontologist or psychiatrist or psychologist, and then they'll do some more testing, and then you can get a diagnosis. So unfortunately, it could be longer than when we want to wait. It's not like I go and I tell you these are things, doc, that's going on with my mom, and they're saying, oh, okay, that's what it is. Some doctors may say, oh, I have a concern, and so they may move, you know, a lot quicker, but it's not a diagnosis you're going to get the first and maybe even second visit.
Okay, well, thank you for that. We also have a question, I think a good question. What are the stages of Alzheimer's?
That's a great question. So the Alzheimer's Association, we recognize the 3 stages of this disease. So it's the beginning stage, early stages of the disease. That stage is so critical because that's the stage you want to enlist the individual who has this disease and what their care will look like. Because their life will change, not only the individual with this disease, but you as the caregiver, you as the family members, you as a loved one. Your life will change drastically also. So in the beginning stage, you begin to see, you notice they forget things. You notice they say things that may not make a lot of sense, right? It could be very subtle, but then you begin to see it's more frequent. So that's the beginning stage. The middle stage is you see a decrease, and not only, I mean, a decrease in their memory, but also their functioning, their cognitive ability, and their behavior. So you'll begin to see, unfortunately, a totally different person. It's still your loved one standing in front of you, but their behavior is totally different. So that middle stage is when you see more of a decline of behavior, the memory. They may not remember family members anymore. They may not, in case my mother didn't remember us, you know, broke our heart when she didn't know that we were her children. So you also probably see a more of a decline in their physical capabilities. And then there's the final stage, which is the severe stage. That's normally, you know, when the individuals may no longer be eating on their own. They may be, you know, fed by a tube. They may not be walking anymore. They may not be talking at all anymore. You know, maybe having a couple of falls, maybe having a couple of bouts of pneumonia, and constant pain. And that's the stage that's fatal. And normally this disease, and it depends on the individual, it's about, you know, life expectancy, about 10 to 12 years. Some people have surpassed that, and some people, unfortunately, have not gone as long. So those are the 3 stages of the disease. But I can't stress how important it is to make sure that you sit down with the individual in the beginning stage and you talk about powers of attorney and medical powers of attorney, because not only, you know, will your life change, their life is going to change also. So and it's a tough journey. I wish I could tell you it's not. But it is. So you want to do everything that you can to have support for you and the individual. So those are the 3 stages of the disease.
Okay, thank you. So we have a couple of more questions that came. Has there been an increase in the prevalence of Alzheimer's now that we have more distractions like technology and social media?
So not so much as it relates to social media. You know, Alzheimer's disease is not new. This disease is over 100 years old. You know, Dr. Alzheimer's diagnosed it, and when he diagnosed it in younger people. It was a woman who was in her 30s. But really, when we look at our lifestyles, right, when we look at all those things that put us at risk, aside from having the gene, you know, not living healthy lifestyles, and healthy meaning taking care of our body. Sorry about that. So making sure that, you know, we are being more active, not just physically, but cognitively as well. So, you know, there are things that we can do on the computer that can certainly help with our brain. Absolutely. But, you know, yeah, the numbers are increasing, and the numbers are increasing in those communities I talked about, and also in women across the board. So trying to really pinpoint what it is, but we know, you know, the research shows that looking at those areas that I discussed, those put us at greater risk. You know, healthy diet, making sure we get exercise, making sure we're using our brain, and making sure, you know, we're staying socially engaged, even in during this pandemic, that we're staying socially engaged virtually and getting the appropriate amount of sleep.
Another question, is there a typical timeline for how fast the disease progresses, or is it different from person to person?
It's different from person to person, but remember the average life expectancy is about 10 to 12 years, but it could be different from person to person. I will say individuals, you know, live longer because of the research that has been done, and, you know, in the early diagnosis. So individuals are living longer than when, you know, say my mom had it. My mother had it for 10 years. She lived with it for 10 years. And they, you know, they just thought that was just amazing that she lived with it that long. And, you know, back in 1998. So it depends on each person. And the same thing with all of the therapy, it works differently on everybody. So you'll meet people, they have a loved one, oh, take this or do this because it worked for my loved one. And it very well may have or is, but, you know, we're all different. So you want to talk to your doctor, talk to all the individuals involved and find out the best treatment to help, you know, in the life expectancy, if you will, of the individual.
Sounds good. Also, the question is how to determine Alzheimer's versus other dementia. Their mother has been dealing with them in quotations following her, stealing things, watching her. They even make the birds chirp too much just to annoy her. And they've been dealing with this on and off for years, but there has not been any kind of Alzheimer's or dementia diagnosis from the doctor.
Wow. So a couple of things. You may want to consider going to another doctor. You know, maybe their mom needs to see a specialist because it could be something else, right? So, you know, if you're not getting the results you see from the doctor that she's currently going to, you know, always go to another doctor, ask for a referral. You know, there could be something else. It could be a family history of something else. Because a lot of times, unfortunately, doctors are not quick to make this diagnosis. And they're not the ones to make this diagnosis. So, you know, look, doc, these are the things that were going on with mom and they're continuing to go on. We think there may be dementia or Alzheimer's. Can we start the process of having that test done? And if they're not willing to do that for whatever reason, you may want to, you know, look to another physician.
Two more questions. How long does the last stage of the Alzheimer disease, how long would that last? Is there a time of how long that would last, the last stage?
Once again, it all depends on the individual, and every person is different. You know, and people have a will, right? They have a will to I mean, you know, I like to be very honest and candid. This disease is a horrible disease. Not only does it take our loved one away from us while they're still with us, but it completely destroys the brain and everything within them. And in the end stage, they're in a lot of pain. I remember my mother being in so much pain, you know, in the end stages that she was on morphine. And my mother was 6'1", so, you know, they give you according to your height. She lost all this weight, but like she was in so much pain. Just to touch her was so painful. So it all depends on the individual. So there's not like, oh, the last stage will be 5 years or 3 years. You know, there's no medical thing that pinpoints that. You just know when the individual is in their final stage, you know, it doesn't last as long as, you know, the moderate or the beginning stage.
So there's two more questions, but maybe we can combine them together. One question is, if someone is 90 plus years old, should you have them tested or just let them be? And what other forms of dementia are there? We know that there's different forms of Alzheimer, but are there other forms of dementia?
Okay, so if someone is 90, you know, that's a decision you make with your loved one and your family. If they're exhibiting signs, I would say yes, because remember, early diagnosis is key. Because by saying, oh, they just have it, you know, I think we did this for years. Oh, that's just grandma, she's senile. They just have that old person's disease. You know, there's a lot of things that they would need medical assistance with, and they would need help to help them have, you know, a healthier life for however long it was. And just because someone's 90, I would certainly say do not get them tested for that fact. Absolutely. I would say yes, but that's my personal opinion. I would talk with you know, the person's healthcare provider and other family members. But if you do suspect that there may be some form of dementia or Alzheimer's, absolutely, I would say get them tested. And as far as so Alzheimer's is a form of dementia. Dementia is the umbrella. Alzheimer's is the form of dementia that is fatal. There's no cure for it. There's no reversing it. So the other forms of dementia, and 70–80% of all dementia cases, unfortunately, are Alzheimer's. So the other ones are Lewy body, which presents itself if someone had Parkinson's disease. So, you know, they have some of the tremors, some of the, you know, shaking. They do have some issues with memory, but not to the point where it disrupts their daily life. They're still able to function. It's kind of more like a physical. They have a physical decline. There's vascular dementia, where someone may have suffered from a heart attack or strokes or both. Normally individuals with diabetes. So, you know, that the body not being in the best shape or being unhealthy in that way will have an effect on the individual's memory and some functioning. Frontal temporal lobar dementia, you know, that's someone who's experienced a traumatic head injury. We're seeing a lot more football players, young folks, young guys saying, you know what, it's not worth it me having all these concussions, and, you know, in 10 years, I'm gonna not be able to remember anything or not have a good quality of life. Or someone maybe had been in a car accident. So that's another form. And then there's mixed. You can have one or more of the dementias. And as I shared, my mother was, you know, diagnosed with vascular, but she also kind of went into Alzheimer's. And that was the part that, you know, that was the fatal part for her. So you can have more than one. So those are the different dementias.
Question, are Alzheimer tests covered by insurance? And then we'll probably have time for just one more after you answer that one.
So it all depends on what test you're trying to take. If it's a genetic test, I believe Blue Cross and Blue Shield is the one that covers genetic testing. That test is roughly about $1,000. But as I stated, you can, the other tests, yes, they are covered. So the genetic one is different. That's a different test. That's a more expensive test. And I think Blue Cross and Blue Shield is the one that covers that. But now they can simply do a scan of your brain, a PET scan, and they can see what the brain look like and what's going on, and make the diagnosis from there.
So someone said that there's supposed to be a patch that is supposed to slow the effects of Alzheimer's. And do you know of anything else that is currently being provided or researched? I think you said in the beginning that there is no cure, but is there anything that will slow the effects of the disease?
Unfortunately, there's no cure for this disease. There's nothing that will slow it down. There's nothing that will reverse it. No, there is nothing. And I know a lot of claims have been made, and the FDA last year, you know, they sent out notification telling companies that you have to stop saying there's a cure for this disease, and even threaten to fine them because there is no cure, and you're giving family members and people a false hope. There are people who tell you, oh, eat lots of coconut oil, eat this, do that. Unfortunately, there is no cure from Alzheimer's disease. There's no slowing down the progression of it. The brain cells are being destroyed and they're deteriorating. And unfortunately, there's nothing that can stop that or slow that process down.
Well, Tara, thank you on behalf of everyone who watched today for sharing your knowledge with us. We hope that everyone that was on have learned some valuable information to help them with whatever you know, that they're dealing with, or just learning more information. We invite all those who have joined us to check out beconet.com/flourish for our upcoming virtual events and to watch previous events on demand. Again, we thank you, Tara, and we thank you all for joining us today.
Thank you all. Thank you for allowing me to be here. Please take care. Stay safe, everyone.